I'm a board-certified neurological surgeon. My undergraduate training actually was in aeronautical engineering, and then I went into medicine and finished my residency and training at Case Western Reserve University in Cleveland, Ohio. I've been a practicing neurosurgeon for over 30 years now. Well, it's obviously very helpful these days in medicine with all the high-tech changes to actually have an engineering background and having some understanding of the technology that we're working with, both from the electronic computer end of things, but also in the mechanical tools we have available. And this is a good example of high-tech technical stuff that gives us a great edge, gives us a great tool, but it's helpful as an engineer to have a little understanding of the mechanics of how this stuff works. So it's been fun to be involved with it. There's a couple areas that are a big concern for a practicing physician. First is that many patients are sent to us based on the fact that their diagnostic studies, such as their lumbar MRI scan, may show some abnormalities. In reality, most people have abnormalities on their scan. So it's a matter of trying to correlate what we see on a scan with what is actually happening with the patient. The second big area we have is trying to objectively measure what changes there are in a patient's level of performance and how that correlates with their actual job requirements. The beauty of the CRT technology is that we now have an objective way and a reproducible way to measure that performance loss and then be able to equate that specifically to their job requirements. That level of expertise we've never had before. Well, there's a couple things. First is we're in the office evaluating a patient. We need to know the specifics of their job, and we actually don't very often know the real details of what's required in the body mechanics of their job. So we're asked to evaluate someone whose job we know little about, and then be able to say, are they really ready to handle that particular job activity? That requires being able to test their joint movement, their strength, their endurance, essentially their performance, which a physician's office is not set up to do. We don't have the tools available to us to do that. CRT, however, provides that degree of objective measurement, which can actually tell joint movement by joint movement whether that patient is able to do the things required of their job. And that's a huge benefit to a physician when he's trying to make a very difficult decision, particularly with a patient that may say, I just don't feel good, I don't think I can do my job. We can now say, yes, you can, and that you are able to safely go back and do your job. Without CRT, we're sitting in an office confronted with a patient who may be reluctant to go to work, may not be able to go back to work, and we have to make that determination. Without an objective assessment that we can stand behind, we're oftentimes forced to simply ask the patient, do you feel ready to go? And if they say no, it's another month off work. And that's why so often a lot of work comp problems get dragged out for extended periods of time, because we just don't have a fair, objective way to tell the patient you are ready and you are safe to go back to work. With that tool, it's not that we need to be forcing people, but we can be much stronger in our push to say you are ready to go. And when we do have that patient who you think the result of, let's say, an operation, everything looks good, but actually when they're measured, let's say their performance is not ready to handle their specific job. And that's a very important protection for the patient as well, so that they're not forced back into something that they aren't able to handle. So that objective measurement is a safeguard for both the patient and the employer. Incumbent testing is a very unique and different testing that we've never had that's a part of our practice before. What incumbent testing involves is that patients who basically are as employees are evaluated before there's any injury. So you actually have a baseline measurement of their performance level, joint by joint, so you know what they can do involving all their extremities, back, etc., so that if something happens, you can compare their present state to where they were before the injury. Now, in treating a patient, you'd say that's not terribly important. I have to fix whatever problem I have to address, and that's true. But in the later stage, when you're asked at their point of recovery, how does that now compare to where they were before the injury? Now we actually have a measurement to compare against. As an example, their arm injury may be fine, their movement may be fine. They may have a deficit in their left arm that's unrelated to their work that was there before. So we can clearly say, okay, if someone just measured them, they would say there's a problem with their left arm, and we say, yes, that was there before, that's not related to any component of the actual work injury. So from the employer insurance standpoint, that's a huge issue and extremely beneficial information. Well, a malinger is someone who tends to embellish their problems, their complaints, is someone who obviously is not interested in returning to work, wants the time off, or maybe is looking for a bigger secondary gain in the financial part of this whole industry. And we're confronted with those patients not infrequently. Obviously, most patients are reasonable, well-motivated people who do want to get better, do want to go back to work. But you do have that segment who is simply exacerbating what's going on and is looking for maybe more financial gain. Part of what impedes us, again, as a physician, is that we're not able to oftentimes separate those well. There are some people where their complaints simply don't make much sense, and you can kind of pick out that rare patient. But there's a group that you're unsure. Are they legitimate? Are they embellishing? And being able to objectively measure where their performance is, you can stay with a firm hand that you do not have a performance loss. You are able to carry out the functions of your job, and we can show it, and we can be satisfied that you're safe to go back to it. So it can pick out those people who, again, may be just embellishing, or those who are truly fraudulently saying that they have problems that they don't. So those that are really trying to illegally game the system could be sorted out as well. Oh, I think their benefit is huge. Obviously, the benefit is huge in the financial sense. And the reason being is that the work comp problem for many employers is a big, big financial burden. Particularly if they have a lot of turnover of transient employees who are coming in with unknown baseline performance levels and then say, I now have an injury. The ability to actually measure them beforehand, know if they indeed are injured, document that it's a true injury, and then measure how it's changed from their baseline is light years ahead of where we were a decade ago.